long hauler patients are relatively new to the medical profession, so there's no decisive protocol for treating them, but you can work to build your immune system, and that can make a major difference in how you feel. Joining us now is functional medicine expert Dr. Cathleen Gerenger. Dr. Kathleen, it is always so great to have you on Bloom.
It's so great to be here.
So let's talk about long hauler symptoms, because you say that to people and you're like, a long hauler, what does that mean?
That means that if you have symptoms after you're contracted COVID, vaccinated or unvaccinated, symptoms such as brain fog, poor in concentration, shortness of breath, or even inflammatory markers such as like anxiety, sleep problems, sleep disturbance.
Yeah, there seems to be so many, and we're going to be talking about them throughout the show. But I mean, you know, there's been articles linking shingles and an increase of cases in shingles due to COVID. You know, sexual dysfunction, hair loss. I mean, the list goes on, and people could be walking around just not feeling right and not realize that it's actually linked to the virus if they had it, vaccinated or not vaccinated.
Absolutely. What happens is that when we're exposed to the COVID virus, what it does is that it has these little spike proteins, and these little spikes, what they do is they adhere to your endothelial tissue or even your epithelial tissue. Endothelial tissues are inside your blood vessels, and epithelial tissues are kind of like around your organs. And what we want to do is that we want to boost up our immune system, support our immune system, because there's really not a classic protocol or a standard protocol to treat long haulers.
So what are you doing for your patients to make them feel better? I know you're big on getting a really detailed base blood work done so that you can get an inside look at what's happening in someone's body.
Exactly. What I do is that I run inflammatory biomarkers such as C-reactive protein, homocysteine, fibrinogen, and something called IL-8. It's called interleukin 8. What it is that it actually allows us to see where is the inflammatory markers are. And sometimes it's kind of like in our genes too. So 1/3 of us might have that gene. So if you fall into the category where you're sitting for like at least like 2 hours and you can't sit, you have to stand up, those are kind of like a red flag. It's like, ooh, I better check those markers.
That's so fascinating. So what are, I mean, we just said that it's so new to the medical profession that, you know, people are just learning more and more with every study that comes out. So how are you helping patients build their immune systems and feel better?
When we talk about building the immune system, I always go back to food. Food is medicine. So I say increase antioxidant levels or anti-inflammatory markers, such as like making sure you incorporate like green tea, ginger. We talked a lot about ginger. It's anti-inflammatory. Turmeric or curcumin, and also something called camu. Camu has like about 2,000 milligrams of vitamin C, more than vitamin C itself.
What other things, because I know you were looking at blood markers, including mine, and Epstein-Barr is starting to surface a lot, and that could be a big reason as to why people are feeling so run down. And I just read an article this morning that too is associated with COVID-19.
Exactly. Epstein-Barr virus stays within our body. Usually I screen that if somebody has a history of mono when they were younger. They call it the kissing disease. But what happens is that as we start aging and then our immune system starts to be compromised, exposed to the COVID-19 virus or whatever you're exposed to, what we see is that there's a spike in the Epstein-Barr virus, because I have a baseline of blood work in most of my patients, and then suddenly the spike up of Epstein-Barr virus.
That's crazy. So you mentioned some of the foods that we should be eating or drinking. Anything else that we need to do to boost our immune systems?
Yes, supplementation is key. Take something like omega essential fatty acid. It's called a COX inhibitor. What it does is that it decreases the inflammatory response. Another thing that I like to take is some niacin. Niacin is B3. Again, that really helps the body to decrease the inflammatory markers too.
Do you find it interesting that people like, you know, maybe didn't even see a lot of symptoms of COVID, but they're still seeing these residuals?
Yes, it lasts about 6 weeks all the way to months or even years. I mean, we don't really have a simple solution or this is a pill for this. all we can do is control what we put inside our body. All we can do is kind of like safeguard those inflammatory markers. That's why it's so important for us to have a baseline to see where the inflammatory markers are. How are we going to track that and decrease those markers?
Do you think because of herd immunity and the fact that we're probably getting reinfected without even knowing could be exacerbating this problem of COVID long haulers?
I feel like when we get reinfected, hopefully our immune system is strong enough where we become resilient to it.
Okay.
Yes.
So that's what we should be trying to achieve.
Yes.
It's just constantly working on a stronger immune system, because that's really, I mean, we see that the vaccines, of course, were very helpful. That doesn't make it people immune to all of the residuals of COVID-19. What a mystery this is, but we're proud to have doctors like yourself come on the show and talk to people about how they can help themselves be stronger.
Yes.
Thanks, Dr. Kathleen.
You're welcome.